All right, welcome, Dr. Debbie. Thank you so much for being on our Spotlight series here for the Best in Utah in Public Health. I'm excited to jump in and get to know all the things about your clinic. And first off, I want to just read a quick bio so everyone knows who you are.
Okay.
Dr. Deb is the founder of Platinum Chiropractic and has been in practice for over 7 years. Her specialty is in perinatal and pediatrics and has just celebrated 3 years in Utah. Woohoo! Her mission is to educate, empower, and inspire members of our community by providing platinum quality chiropractic care to families. Yay! I'm so excited to have you on here. So,
Super excited to be here.
yeah. So, first off, question is what made you decide to be a chiropractor?
That's kind of a long story, but in short, I grew up in Asia. So culture-wise, when it comes to approach for healthcare, we always start from the least invasive, really, to the most invasive. So when we were growing up, medication, surgery, and all those is never like the first option. So when I moved to America when I was 17 and, have friends and family that gone through a lot of like health struggles in my mind, and I was like, okay, there are a lot of other stuff that we could have done first before we get to, a point of like surgery. And my grandmother actually passed away from a surgery table because she couldn't make it, so kind of like full circle after that, I was like, my mom kind of mentioned, was like, oh, if we would have known and brought your, grandmother to a chiropractor, she may still be hanging out around here. So that's kind of the
Oh,
short story of how I became a chiropractor.
wow. Wow. Cool. What do you feel like makes you and your company different?
Our approach was very different compared to traditional chiropractic care, especially with, working with, moms and kids too. When most people think about chiropractic, they're like, oh, headaches, back pain, neck pain, and whatnot. We deal with those, but about 20% is just that, right? Because we focus a lot more of the nervous system, and especially with babies, they don't have back pain, headaches at that young age. But what we start seeing is a lot of like nervous system dysfunction that causing a lot of like the simple tasks like eat, sleep, and poop is going off early on in life. And as they get older, that grow into a lot of other symptoms, whether it's like speech delay, sensory processing, and a lot of just arrays of symptoms that we see. And that's what our primary focus is really. Okay, let's look into the nervous system that controls all systems of the body and see exactly what it stems from. So,
Cool. Who would you say would be like an ideal fit for you, like the people that you see on your table every day?
every day it's really the stressful mom that is looking for answers. I've just not just for themselves, but for the kids, because I have had the amount of parents that comes in that they're like, oh yeah, we've gone to like different specialists for like stomach issues and whatnot, run hundreds of tests, and it was like everything came back normal. And then they came here like, oh, it actually makes sense when we look into like the nervous system and all those. So it's really your everyday mom that is looking for answers and help.
Mm-hmm. Mm-hmm. Amazing. Okay. What does the process look like to work with you and your company?
So our initial visit, we call it a discovery day because we actually want to sit down with you and figure out, okay, what the health challenges that you're currently facing, what's the previous history that can contribute to all of this, and of course, we're going to do our scans and get more information based off of what you're experiencing. And after that, we'll sit down and go over all those results and then come up with a game plan and see, hey, what's the best frequency to actually
Mm-hmm.
get everything working properly again.
Mm-hmm. Okay, awesome. And then what would you describe in like your clinical ethos from what you see in your day-to-day life? What does recovery look like from that transition from pregnancy to postpartum and things like that?
Pregnancy from postpartum, that is based, of course, is based off of each patient. I've seen a lot of people that is like extremely active, a lot more proactive with their health early on, even pre-pregnancy. Those are the patients that bounce back a lot quicker, kind of like between that 6 months period. But then I also seen a lot of people that are like, okay, we're like 4 kids in, a lot of different stress that is on the table, let alone just, physical stress that postpartum that comes with. Those typically takes a lot longer, I mean, you're looking at minimum of 8 to 12 months or even more.
Yeah, yeah. Okay. What is something that most people don't know that you think that they should know, whether that's about chiropractic, about yourself, about anything health and wellness wise?
Most people, I would say most people don't know that in general, chiropractic is beyond back pain, neck pain.
Mhm.
Um, because the amount of, consultation that we've gone through, and mom was like, wait, so you're telling me how is it related to ear infections and like chronic, congestion and all those, that's all related to your body, this nervous system function and all of those. It's
Yeah,
kind of like all the basic stuff that we deal with
I'll
on
be
a
on
regular basis.
neck and back pain for sure. Okay. Is there anything special that you want to promote to the audience watching here?
Right now we are partnering with Deep Roots Nutrition,
Oh,
Brittany Fox,
yes, yes.
doing a class is on November 6th
Oh,
at
exciting.
6:30 about uh nutrition when it comes to like pregnancy, postpartum, all of those fun things.
Love
And she's
that. She's going
amazing.
to be on our spotlight too.
Awesome.
Yeah. Okay. Awesome. Well, thanks for that information. Then last question here. My favorite question to ask is, what do you want to be known for?
I want to be known for the person that our community, our moms, can lean on, like during the hardest part. I mean, so a lot of moms say that, oh, giving birth is rough, but most people don't say, hey, postpartum, taking care of baby while healing is very rough as well. And that's why I love the work that you provide, because that is all about that, just being the support for mom. And coming from like an Asian culture, like in my culture, when a mom gave birth, like they have a 30-day confinement just to get rest and recover, taking care of baby. That's just their focus. But it's just in our Western culture,
Yeah.
it's just
Totally
not a thing. It's like you have baby, it's like just jump back the next day and doing all those things. So just being able to be a support and not just like in their healing process, in their, physical, mental, social, emotional healing, but more so just be there for them. Sometimes they're like, "Ah, I just needed that 1 minute." You hold a baby, you hold a baby for them and they just needed that, 60 seconds. Yeah.
Totally. Amazing, amazing. Okay. Where can we find you? Website, social media, all the things.
Website is platinumchirout.com. You can always find us on Facebook. I think it's just platinum.chiropractic, and also on Instagram as well. We try to be pretty active on social media, posting a lot more educational videos just for families.
Oh, love
And
that. Love
we're
it.
located in American Fork, right by the American Fork Hospital.
Perfect. Perfect. Well, thank you so much, Dr. W, for coming on and speaking on the Spotlight series. It's been a pleasure working with you, and thank you so much for what you do in the community
Yeah,
here.
thanks for all you do, and thanks for having me.
Yeah.